Hi, I'm Dr. Carlos Alves. I'm a heart rhythm specialist, work at Los Robles Hospital, and I deal with cardiac arrhythmias. So the heart has an intrinsic heartbeat, has its own intrinsic pacemaker system, and generally most people's hearts are regular, and they function in relation to what the cardiac demands are, so that when somebody's at rest, their pulse tends to be slow, and when they're with exertion, their pulse tends to be fast. That happens in a predictable, controlled fashion, and arrhythmia is anything that deviates from that. Either the heart's too slow or too fast. We feel extra heartbeats, palpitations they call them. Some people call them flutters. These can vary from anything lasting a half a second to minutes to hours. Some people don't feel anything. That's a little bit scary. Some people get dizzy or lightheaded and they pass out because of hearts being too fast or too slow. And it doesn't have any correlation to how serious the disorder is to the amount of symptoms that somebody has. So it requires some investigation usually. We don't know in the vast majority of things. The extra heartbeats are caused sometimes by irritable nerve endings in the heart, by electrolyte imbalances that causes the tissue itself to fire. Sometimes it can be caused by weakened heart muscles if it comes from the bottom chambers, viral infections such as the novel virus, thyroid disorders, other hormonal imbalances. But in the vast majority of patients, everything is working well except a small focus inside of the heart just fires. Some people were born with additional pathways that cause arrhythmias. Usually these people be in the younger range, but sometimes they can present later in life as well. So there's a large gamut of causes of arrhythmias. Generally, most arrhythmias are temporary. They happen for a structural reason. They tend to get worse as you get older. Also, your ability to tolerate very fast heart rhythms diminishes as you get older. So you may be able to tolerate 170 beats a minute when you're young, but you may not tolerate that when you're 85. As you get older, sometimes the heart's a little bit stiffer. They don't feel as well, and so they require increased heart rates. So it's best to deal with them when people are relatively young and healthy and generally can tolerate the procedure better. In a simplified version, we find a way to get inside of the heart, usually through the femoral veins, and go inside of the heart and map out where the extra heartbeats are coming from. If they're mappable, if they're unmappable, then we usually call that atrial fibrillation, and we generally just do an anatomical based approach, ablation. Ablation means removal of extraneous tissue that is not needed. We can do that in one of two forms. We can either freeze it or we can either burn it, in general terms. The two are equivalently effective. They require different tools and different techniques. We're equipped to handle both of those things. The amount of recovery is a little bit different between the two, but the success rates tend to be, in the high 90 for most of the arrhythmias that we have. Rarely do we have anything less than 75% success. Medications are at most about 30% effective, the ones that we do have. So ablation is for most people the first line therapy because it's well tolerated. It's very successful and has a very limited risk of complications.